Hello, I am Dr. Debjani Roy Choudhury, consultant neurologist, Techno India Dama Hospital. Today I am going to share some facts regarding stroke. Stroke is the second leading cause of death worldwide. It is the leading cause of serious long-term disability. About 88% strokes are ischemic and 12% are hemorrhagic. Male are much more predisposed to stroke than female. Stroke are of two types, hemorrhagic and ischemic. Ischemic stroke occurs when blood clot blocks the brain arteries supplying the brain, and hemorrhagic stroke occurs when the blood vessels burst within the brain. We must know 6 key facts regarding the stroke. We have to recognize stroke earlier. For that we have the mnemonic B first. B stands for the balance, any impairment in balance. E stands for the eyes, that is any blurring of vision or double vision. F stands for the face, that is drooping of face. A stands for the weakness of arms or the leg unilateral. S stands for the speech, that is the slurring of speech, and time. T stands for the time. Time is the brain, and we need to call the ambulance immediately. Beyond B first, there are other symptoms like sudden numbness, sudden confusion, and sudden severe headache. Around 1 in more than 10 people make an excellent recovery when cared for in a specialized stroke unit, and we have the clot busting therapy, and which increases the chance of good outcome by 30%, but it is a time bound therapy and we have to give it by 4.5 hours. We have the clot retrieval therapy, which enhances the good outcome by more than 50%. And rehabilitation is a critical step in treatment process, and it should be started as early as possible. And 1 in 4 survivor will have another stroke in future, so we have to control the risk factors. For that there are several stroke mimics and several stroke risk factors. Some are non-modifiable and some are modifiable. 1 in 4 of us will have stroke in our lifetime. So we have to identify and treat the heart conditions like atrial fibrillations. We have to reduce the alcohol intake. We have to reduce the bad cholesterol like LDL. We have to manage the diabetes adequately. We have to exercise adequately. We have to control blood pressure. We have to stop smoking and avoid the smoky environment. We have to manage stress and depression and maintain a healthy weight. So take home message, stroke can happen at any age. Young stroke is very common nowadays. Early stroke management should be instituted to reduce mortality and disability. Prevention is better than cure. 80% stroke can be prevented by rightly managing the risk factors. We are well equipped to manage stroke patients in Techno India Dama Hospital. So please do come if you have any stroke patients and if you have any stroke related inquiry. Thank you everybody.